You are listening to Radio Maria Canada. We now present the Health Hub, hosted by Cathy Biase.
Welcome to the Health Hub on Radio Maria Canada, exploring cutting-edge health and wellness information and therapies, helping you to take your health to the next level. I'm your host, Cathy Biase, and I'm an holistic nutritionist and a professional cancer coach. What if the biggest problem in healthcare isn't the quality of care, but everything that's going on and happening behind the scenes? On today's show, we are looking into a side of healthcare most people never see, yet it impacts every patient, every provider, and every outcome. Because while hospitals are filled with world-class clinicians and life-saving technology, many of the systems supporting them are still surprisingly fragmented, inefficient, and at times unreliable. My guest today is Sam Yeruva, and he's the founder and CEO of PieCube, a company at the forefront of transforming hospital operations through real-time data and operational intelligence. After witnessing firsthand how something as critical as biopsy samples could be lost for days, Sam set out to solve a problem that most people didn't even realize existed. In our conversation, we explore what it really means to be a smart hospital, why efficiency is not just a business metric, but a patient safety issue, and how practical, real-world AI is already helping hospitals recover time, reduce burnout, and improve care. We also talk about the hidden waste inside the healthcare system, the silent drivers of clinical burnout, and how reimagining workflows could allow doctors and nurses to truly operate at the top of their license. This is a powerful show about how fixing systems can ultimately save lives, and why the future of healthcare may depend just as much on operational intelligence as it does on clinical excellence. Please stay tuned. We will be back in just a few minutes to speak with Sam Yeruva.
You are listening to Radio Maria Canada. We now continue with the program, The Health Hub, hosted by Cathy Biase.
Welcome back to the Health Hub. Please do follow us on our social sites. We are on Instagram, X, and Facebook, and we are at the Health Hub RMC on those locations. Sam, welcome to the show.
Thank you, Cathy. Happy to be here.
Through the introduction, people have a pretty good idea of where we're going along the lines of the show. But to start out wide here, you've said that hospitals are clinically world-class, but operationally held together with duct tape. Just to give us an idea of what your company is and why you're doing what you're doing, what's behind the scenes that most people would be shocked to know about when we're talking about the healthcare system or hospitals?
Yes. So I am an engineer. So that comment that we feel that the health systems are held together with the duct tape is because it's a business. When they come together and help communities in some areas. I was back in the day when I went into one of the big hospitals, which was well known. When you walk into it, it looks like a 7-star hotel, all marble floors. And when you get in and you have these big, LED displays and everything of that sort. But when I start peeling off the onion and start working with the administrative side of the hospital, and when you start working with them, you feel the pain. The nurses who are working there overworked, sometimes they miss on certain things. There are administrative areas where they don't have the right tools to actually do certain things. It depends on the area. Some hospitals are bad, some hospitals are better. Um, the data that you need to flow for a patient care, if I or you were going in, I felt they were all in different silos and they were held together with a duct tape that the
Mm.
data doesn't flow. And the care that you get, even though it's good, it's getting better. It's just they're connected together through a duct tape, which can get out, or you could stop sharing the data and having information. For us as a layman who's getting in, like I want the best of the best. That's what we want for our care and everything of that sort. But when you start peeling up the onion and go to the other side of the hospital and the back side of it, administrative side of it, there are areas that can improve a lot. And that's where we started working and bringing in efficiencies. The goal of us to is to do is may create a nervous system where the data is flowing through and the person who's coming in is able to get the best care possible in a setting, because we're by the time we are in the hospital, we're already stressed out, and you don't
Hmm.
take care of yourself or your loved ones. How do we help them? And that's the vision and goal of PyCube. That's where we're trying to help.
Now, you had a personal experience with biopsy samples that were lost for, I think, 10 days.
Yeah.
Um, how did that shape your company? I guess the starting of your company, but also the mission behind your company.
Yeah, so that was an interesting time of my life when I was talking to, you have friends. When we're talking to some of them, I was telling my friend that, hey, we are a technology company and we're assisting health systems. And I didn't know how to, we never went into the clinical side of it. He said, if you really want to help us, why don't you help me this? I had 10 biopsies, or a couple of biopsies from our patients. It was a children's hospital, and they got 10 biopsies from patients who were kids who were under the knife. And the biopsies came in, and it took them 10 days to get to their lab. I said, what? Why? They were stuck in the loading dock, and they were not informed that the biopsies were sitting in the loading dock, and they never went to care to go back and get them. By the time they realized and started bringing it in, they're already expired and stuff.
Mm.
So she comes back and says, what do we do about this? Who's going to tell the parents to actually put their kids under the knife again? Who's going to pay for this? What is going to happen? There's so many things that happen, and I don't have any visibility into it. Now, what if one of the child has cancer and I've not been able to diagnose it? I I don't. Does it happen? Then we'll talk to then I said, okay, fine. Can I talk to someone else? Is it really valid? Is it a one-time thing? When I talked to the VP of supply chain there, I was expecting, it happens very rarely. But he says, yeah, it happens. We lose samples, we lose, sometimes body parts. They're delivered, but it's not intention is right. It's just they don't have visibility. They don't have the tools. They don't have the information or notification of something is coming in. And sometimes, seldom, things do get lost. And it's that got me thinking, how is it possible in 21st century? Does it really happen? Don't we have the right tools? Is it so? What you're saying is, if have a need and I'm coming in, there is a chance that my sample could be lost. That yeah, that could be lost because we don't have those mechanisms. So we noticed that there are some white spaces where you could actually play in and start helping out the health systems, because it is saving a life, and it is definitely a patient behind every sample that is being utilized. So we started working around that patient, and I put my son in the middle. I said, "What? How would I react if my son had some
Right.
issue?" And when my wife might be praying, I might be praying, saying nothing should happen to him, and suddenly I come to know that the sample was lost, and I don't even know what happened to him. That is a worst case scenario. So when we put our loved ones in the middle, then the pain becomes real, and that's how we started looking at solutions from outside in, and what is the experience we would like to have, and how do we build these and solve these problems, and started working with some more hospitals and noticed that it is an ubiquitous problem. They all have the same problem. It
Mhm.
doesn't matter it's in Canada or in US. There are problems that are legit. And we started working on those areas where we could actually bring in efficiency into these areas where we could save a life somewhere.
Well, where exactly do hospital operations break down the most? Where is the focus of your Is it people? Is it systems? Is it in communication, or is it a grand combination of all?
Well, I would say in a process, right? It's a health system, healthcare, hospitals, they're all service company, Kathy. So what happens is I always believe that there are four pieces, four pillars that actually make it work, right? Your question is right on. You can't point a finger at one of them, but typically what happens in a process, you need people, a trained person who can actually do certain things, or a team that works. You need a process that you have to follow. You need a tool that is trained, and then there needs to be training. So you need a tool, you need training, you need process, you need people. And there is a fourth piece of the puzzle. They're interconnected. Not only they're interconnected, let's say there is a person who comes to the hospital with a condition which requires, cardiology and nephrology, but their test is not in that hospital. They might be sending your test or your sample, your tissue, depending on what kind of problems they have. They might actually work with a hospital which is, in New York, and they have to ship it there. They have to test it and give it back based on the diagnosis that they actually give. Then they have to, give you the right medication. So it's not just in this particular area, it depends on, because it's a variability of what condition you have. Healthcare is still getting better every day. They do have this complex networks of where do I get it tested? How do I get this data? What happens? In this whole piece of the puzzle, there are definitely gaps where they're not able to do it. It's not you train the person as much. And it's also, I feel health system is a horizontal environment. That means a cardiology guy gets exposed to a cardiology in their four walls, they're very good at it. Nephrology, they get very good at it. Pathology guys are very good at their pathology. How do you test it? How do you get a sample? How do you maintain it? A blood transfusion, they are trained in that, and they are very good in the four walls. But when they're taking care of a patient, you need to work with them. The blood comes out of the four walls of the blood bank. Now, a nurse who's trained to be an OR nurse has to handle the blood, has to handle the sample. There is a training problem, and there is also outside of your four wall problem. So when you're getting out of your training mechanism, there are other people who work in that area, have to be trained properly to the level that they're handling it properly as well. So it's the complexity of a person's case, and also how things are moving. So it becomes a little complicated, but it comes down to the basic thing. How do you train a person to handle certain cases, and what are the tools that you need to give? It's data, right? How
Mhm.
do you expose this data availability, and how do you handle this? So that's what we're trying to solve here, and also help them to not have the data lost in data, or a sample lost somewhere, how to track them properly, how to get them visualized so that everyone can see the same information around it. We applied some business and technology tricks to it. We did not invent any new technology, but we innovated the business model in this particular thing. Hey, what is the real problem here? How do we solve this problem? And started putting a platform that actually digitizes how things are moving around. So that's a area where we are hitting it, and people are getting, they've not seen these kind of things happening before. So that's what gets us excited.
Well, we're not just talking about then what goes on within the four walls, as you talk, or the walls within a hospital. When
Yeah.
samples have to be externally delivered,
Yeah.
does that not open up a whole area outside of the hospital that's really beyond that control?
That is where the control problem happens, right? So I'll give you an example of one of the partners that we're working with. Here is a hospital where they take care of a lot of patients, right? And what they do is, they're very busy. The nurses are very busy. They take care of multiple patients, and they collect samples from different patients. In the evening, they batch them. They call it batching. That means they take 10 samples, 10 patients that came in today, or 100 patients, whatever comes in. They batch them and they ship it to, 1,000 miles away because of business requirements. They send it to a central lab that actually processes this samples, and gives them report by next day. They ship them, and they keep losing this. Imagine you lose that 100 sample box. It's lost in a FedEx shipment. And when did they come to know? after 2 weeks. What happened to that shipment? I don't know. How many samples were lost? 100 because a box was lost. It depends on how you're batching. Now, 100 people have to be informed. I don't know where to go and find it because it's basically in it. So it's out of your control. It's in the logistics side of it. It's just an example I'm giving you of things happen. Things you do have. It's a business. When you're doing certain business certain ways, there are things out of your control. And what are the pieces that you have to, every business is different. And yes, when it goes out of your control, how do you bring about those data points in the value chain to bring the value back to the person who cares the most, that is a patient, to take care of him? So that's where the problem is. No two hospitals are the same, but all the hospitals are the same. So in a way, they all
Right.
do the same thing, but they don't work the same way because they, cater to the local communities and they might not have all the services locally. So they do have to rely on logistics. They do have to rely on couriers. They do have to rely on different partners to actually bring care back to the local community. So that's where they do the best they can, but they don't have the tools always.
So, would PyCube be, would you say, more to do with responsible data or managing of funds? Because it doesn't sound like the thrust of what you're talking about is a mismanagement of funds. It's more a mismanagement of data and process. Is that correct?
Agreed. I don't want to use the word mismanagement. I would say missing visibility, right? Management goes, mismanagement would go into an intent of a person. I would never question a nurse who's working hard if
Right.
she's
Okay.
mismanaging. I
Fair.
would say they're doing their best to do it, but they don't have the tools. So the data is not coming through and they're living with whatever they have,
Well, what are the
right?
tools that they're missing?
Oh, the data tools that you're talking about, there are tools out there. You have to connect. So, in order for you to get the information, you have to have connected with the local couriers application. And example, I'll give you instead of going this route, which makes it complicated. I'll give you an example of
Okay.
an Uber Eats or an Amazon delivery, right? If Cathy goes out and buys a shampoo from Amazon, you know when it's being shipped, what is happening when it comes in. Probably they'll give you a picture in front of your door as well. Anything can happen, but they have come a long way to give you this. Uber
Yep.
Eats, when Kathy is hungry at 2 o'clock in the afternoon, or you want to feed your kids or something of that sort, you put a pasta order out there. You know exactly when it's being prepared, when it's been picked up, when it's coming in. That is a visibility in today's world, in 21st century, where you're able to see exactly what is happening, so that when you have a problem, you're able to react and get back to them. That is not available in health systems.
Okay.
You're not able to see the entirety of what is happening. Only all you know is they're blind till it's come to my desk. That means when Kathy orders pasta, imagine Uber Eats does not give you all the information. You're just waiting. You're hungry. You're waiting at the door. You don't know what's happening. You're blind till the food is delivered to you. So those kind of tools in the data area are not available in health. It increases the stress of the people because you don't know what to do next, because unless you get the samples, I don't know.
But
So
why are these tools not available? Does it have to do with regulation and restriction and HIPAA and things like that? It seems if, using your example,
yeah,
if a delivery company can
yeah.
be that thorough with their process, why can't hospitals?
Yes, because it's a compliance industry. In
Okay.
a compliance industry, you're absolutely right. Again, those questions have to be asked. You have to be curious about why are we not seeing these kind of things popping up in healthcare. I think I have a theory that says it's in a compliance industry. It doesn't matter it's in healthcare or in finance. You normally, when you have compliance or you have regulation where you don't want to have in the finance industry, you don't want people to know your financial discussion. That means you don't want your first name, last name, your bank account details, and everything go out, or credit card numbers, because it can be hacked. In the healthcare side, you don't want your first name, last name, your date of birth, or your HIPAA mechanisms to be going out. So what they do is they compartmentalize. When you compartmentalize, your silos get created. Tools that come in work in one silo, doesn't work in other silos. So you need to have an elevated mechanism to connect to these silos. That means in a compliance industry, you need to work with the registration of a patient. You need to work with when the tools come in. You need to work with processing of your samples. You need to work with the care coordinators. When you bring all these things together, then you're able to see things. It is not. It's a complex business of health. It's not logistics. Obviously, they don't have control over certain pieces, and they don't want it to be controlled that way. And that creates, I call them wells, data wells. A frog in one well cannot see all the wells around it unless you come out, right? So that's that kind of an analogy when we started looking at it. When you're in one well, that is your life. But when you come out and see there are about multiple wells outside that need the same data to be flowing out so they can do a better job. So we started creating an overlaid mechanism which stands on top of all these tools that can connect them and give you an experience like an Uber Eats or an Amazon Go.
Well, then, just before we end this segment, um, okay, with these operational inefficiencies, what are the hidden risks to patients that they face if nothing is changed? Now, I know you talked about lost samples and so forth, but as you're talking, I'm seeing this bigger picture of
Yeah,
inefficiencies really hitting the bottom line.
yeah.
And so where do you see healthcare a few years down the road if these inefficiencies are not improved upon?
Yeah. So, have you ever heard about this thing, a saying that in our market right now, healthcare does not have enough people. They don't have enough trained nurses, trained
Mm-hmm.
doctors. We all know about that, right?
Mm-hmm.
So what will end up happening is we looked at we are getting older. That means we are living longer. That means healthcare is getting better. We are able to save lives and staying longer. There are more and more diagnostic tests that are coming up. That means 30 years
Yes.
we don't have these kind of tests. Today we are able to test for cancer through colon, through stool, through blood, different kinds of tests coming in. People are preventative testing more. So more and more tests are coming in,
Mm-hmm.
more and more diseases are being realized, more and more therapeutics are coming in. Hence, we are living longer. The longer we live, the more care we need. That is going to create more stress on people as well. So what will end up happening? My theory or our theory at PyCube is we are going to have more tests coming in next 20 years. We are going to have less and less number of people coming in. We are going to have more pressure on the health system because 20 years later, it is not, I wish I had something. You better have something, right? That's because we used to for the last 30 years that I can get tested, I can be saved, and those kind of things. Um, but you won't have so many people working in healthcare because it's very stressful environment, and there are other places coming in as well. Whenever you have these kind of stress, you have to adopt technology. If you don't adopt technology, you're going to stay back. And AI today is helping a lot.
Mm-hmm.
I'll give you an example. 2 years back, some of the problems we were looking at, 2, 3 years, AI just came about 2 years back. Can you imagine?
Yeah. I can't because I use it on the daily.
Yeah, exactly. It's just changed our life. And you'll be surprised. I saw this phenomena in my lifetime 10 years back with cloud.
Mm.
Within 3 years, it got commoditized. That means everyone is using it, it's cheap, people are competing, blah, 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 those kind of things. Now you have so many AI things. 2 years back, I was trying to solve a problem. How do I think? Because our brains are limited, and how do I think from outside of this? I was not able to do that. Now with AI, we were able to solve different problems in a different way, and you're able to do it. So, and you'll be surprised. There is light at the end of the tunnel. Hospitals are adopting AI a lot more than you think in the right places where normal applications cannot be. So tech is being adopted at health systems, and I hope that, but it's adopted in certain areas, not everywhere.
Mm-hmm.
As things progress, I think it's a natural progression of health systems. But you need innovative people coming in and applying in the right places as well. Um, People are going to adopt, health systems are going to adopt AI in the right places by keeping us safe. And this data, the fodder and the raw material for AI is data.
Well, and you got to wonder, just with your last comments there, just before we go to break here, the adoption of AI, which is, we're looking at the positive aspects of AI, of course,
Yeah, yeah.
that are only going to improve, one would assume. Could that actually alleviate, or could that offset, I guess is the right word, the lack of actual human additions to the healthcare system? Will there be a little bit of AI taking over for, these vacuums of places where we're not filling them with human bodies?
Well, I think there is enough room for AI to play with humans. I don't think it's replacing people, but it's definitely working in areas where you can actually. So, how many? I'll give you an example. There will be an initial. Your question is rightly valid because I keep questioning myself as well. Is AI going to take over? In my theory, my view, I don't think that is going to happen in near future. The reason being, when you're when you go to a hospital, you're already really stressed out. That means you're probably in a bad shape by then, right? You need a human touch. You need a person talking to you. You need something. If AI robot comes and talks to you, that's not the same feeling as a Cathy talking to me as a nurse.
Mm-hmm.
Uh, that is the first emotional piece of a human being that is very helpful. AI has a play in preventative, telemedicine kind of a mechanism. AI has a play in automatically fulfilling my medicines and those kind of things. You'll be surprised to see most of these nurses healthcare is a highly skilled environment.
Mm-hmm.
And that means they are educated to a level more than a normal person, and they are educated to actually work there. But they don't work at their highest degrees. A nurse or a doctor who's actually highly skilled, supposed to take care of patient, has a 40% of time, or 20% to 30% of the time working on administrative and documentation.
Yes, exactly. And this is where I meant not to take over from the healthcare, offering up more time.
Yes.
So if note taking doesn't, and I don't know how much time it takes to chart for doctors, but if this can be streamlined by AI, then hopefully doctors and nurses will have more of their time freed up. That's more of the line I was going down.
I think that is area where I think they'll give you 30% or 20%
Mm.
back into area. But laughingly, I would say that I hope they don't forget how to document in the future.
Fair. Yes, I know we're going to forget how to write, and
Yeah,
already with the calligraphy or the type of writing has gone out the window. My kids
yeah,
can't do
my
that.
handwriting is getting bad and bad every.
Yeah, exactly. Sam, we're just going to take a quick break here,
Yeah.
and we'll be back, everybody, in just a few minutes.
Awesome.
You are listening to The Health Hub here on Radio Maria Canada. A Catholic voice wherever you are. To contact us and be a part of the show, email thh@radiomaria.ca. We now continue with the program. Here once again is your host, Cathy Biase.
Welcome back to the Health Hub. Sam, we talked a lot about samples and losing samples and tracking data and that aspect of what you are working with hospitals on.
Yeah.
There are many new nuances, many new tests, many new things, for lack of a better word, coming into hospitals that are life-saving. How do you work with hospitals such that they can afford to have these new, and I can't imagine that it's not just going to pick up more and more as time goes on, the tools that are going to be available to hospitals. How do you prepare hospitals for this as far as bottom lines go?
Well, there are many. It's a very good segue, Kathy. So I would say there are many things happening in hospitals. So new technology is popping up, obviously. Device manufacturing area where, I'll give you an example. About 3 decades back, 2 3 decades back, we had about 7 to 10 um, biomedical assets. That means bedside tools that were used to help patient.
Mm-hmm.
Today it's about 25. There are 25 tools that are used right next to the bed. That there are different things. That means you have more tools to actually take care of the patient. But when you have more cars than your garage can have, where do you park them? Where do you pay the license? What happens in those kind of things, right? So new training has to come in. Nurses have to be trained. So technology, not from um, clinical perspective, also from how to use the tools kind of mechanism. We are also, there are also pressures on the blood side of it, transfusion medicine, where we are actually helping them. Blood is a one parameter within the health system. When you don't have a blood, you can't do OR. OR is not ready yet. It's what happens is blood is something that you're collecting from a patient, but statistically, what we're noticing is year over year, the number of donations is coming down by 1% every year. That means the less and less donations are happening into the health systems. When the demand or supply comes down, obviously the cost of blood is going up. And there is a lot of pressure on the hospitals to keep the wastage out. If there is blood wasted, that means there is gunshot wounds coming in. Suddenly you pick up 3 bags, which you need only 2 of them. A third one is wasted because it's not, it's outside of the fridge and you can't use it. The pathogens grow up when you don't thaw them, when you don't freeze them properly in the right time. There are some areas in that area of pressure where if blood is not available, a hospital is almost becomes, dead. You can't have the OR ready or take care of your patients properly, and now you have to scramble for the right kind of a blood product that is required for a particular patient, like a blood cancer patient, could be could stem cell problems, plasma issues. There are pressures coming up from that perspective as well, not just the supplies that we have, also from a blood perspective, from a tools perspective. Oh, I've used the humidifier in the wrong way, and we have some situations that we have heard that when you don't manage these tools properly, it can be detrimental on the patient as well. So how do we help these nurses to be trained properly on the right tools? At the same time, how the health system, you spend so much money on these technologies to take care of patient, but if you don't manage them properly, now it becomes a nuisance because you have more than what you need. And it becomes a parking problem for a 2-car garage having 10 cars being bought. And now you don't know where to park in your community. And you start getting parking tickets for it. Joint commission, one of the commissions that you have, which actually takes care of it, they do get citations saying, oh, you can't have this here. I don't have a place to put them. Why do you buy them? Did you take care of them? No, I didn't do a PM because I couldn't find it. Nurses are hoarding them. Because you have more of them, now you're able to do certain things that you couldn't do before. New problems are popping up, and we're trying to assist them in how to bring the process together, how to use these technologies, buy the right amounts, keep the right amounts in the par level, and maintain your bottom line. So that as technology comes in, as we're progressing, as people are getting exposed to new technology, there is, as you rightly said in the initial starting of the process, you need to train the personnel properly to manage them properly so that they can be handled carefully so that you can take care of the patient at the end of the day.
Well, a couple of
I know
things
it's
just popping. Yeah, there are a lot of things going on in my head right now. Um, the greater you, the us, I guess,
yeah,
as we see healthcare becoming more intricate, more involved, and the lessening of people in the healthcare system, and
yeah.
you talking about training, and it sounds like training a lot of nurses. I don't hear a lot of training doctors. How do these inefficiencies, that's not even an inefficiency. How do how do you see the future of healthcare with this in mind when it comes to burnout of physicians and doctors? Because I know for a fact that burnout is a huge hit to the bottom line.
Yep. So there are some things what we are seeing in the market. There are so I see hospitals. I shouldn't use it, but a lack of a better term in this particular medium, I could probably say that hospitals are nothing but hotel rooms, expensive hotel rooms. The service they're providing are taking care of patients, right? So
Mhm.
in a hotel, you'll probably get a service of staying for 1 night or 2 nights, and they give you shampoos and stuff. Here, they're actually giving you service of health. Now, in every major, at least in US, in every major city, all the hotel rooms, in this case hospitals, are full. In a rural place, they are 60% full, like a hotel in a rural place as well.
Right.
It's a business. So how do we take, and more people are live in urban area rather than a rural area. So how do we take care of it? So there is a theory coming up, or the people coming in after COVID. What people started doing is, because we didn't have enough beds to take care of patients in, they started testing out a theory of home care, home hospital. It's been there for a long time, but started generalizing, naturalizing. Why don't I send this person home and take care of from there? And I bring in other patient into this bed so that I can, take care of other people. It brings in revenue, it takes care of patients, blah, blah, blah. But it creates a new problem. How do I monitor a person at home? Do I have the tools for it? Okay, now is the bed right? Is the tools right? The nurse was taking care of in one place in a OR room or in a patient area. Now I have to go to their house and take care of it. Yeah, I'm cleaning up a bed, but it gives more revenue. But there are nurses coming up, travel people who go to the house, and phlebotomists are helping out in some ways. How do I keep up with those things? So market is changing. In 20 years, I would suggest that hospitals, ambulatory care, today's world is ambulatory cares. What happened is hospitals started having ambulatory cares today. That means they're not hospitals, but a care that you could come in. Kneecap surgeries are happening in ambulatory care. More and more things are happening in ambulatory. That means they'll discharge you on the same day. That was the phenomena in the last 10 years, 15 years. Next one is going to be home care, in my view, where that is not enough. Now I can't take care of you here, but I have to monitor you for the next 3 days. Why don't you go home and keep sending me? The new tools are going to come in from a technology perspective, how to monitor you from home, it is going to evolve. Why did I tell this? I don't think it's a stagnant body of water that will stay there and you'll be able to see it. I think we are evolving to the next step of taking care, because there are limitations on technology, limitations on real estate, limitations on urban area and real estate. So health is a person's, it's a personal thing for you. When you're being taken care of, what is the best way I can give you the experience, and what is the best way? But I'm seeing very good things in some hospitals. When they're registering, they're also connecting with Uber. There are pregnant women, when they don't have their husbands or anyone taking care of them, or any loved ones around, the hospitals are coming up with technology to automatically order Uber, and you can come into the hospital and you have an experience where you're registering yourself. It takes care of everything. It's making your life easier. There are a lot of things happening in the market where it's improving the experience, but it will open up a newer areas where new technology is going to come in. I think we'll have to keep up with this. The nurses will be reassigned to the home side. The nurses will be reassigned to the customer experience side, but they will be working with the patients in a new way. And how are we going to evolve and how are we going to work is something that we have to keep up. And it's a constant growth area is where we are keeping an eye out.
Well, where does PyCube enter into this? Are you working strictly on the financial side? Bottom line, are you trying to train in technology? I mean, this is a vast, vast area.
Yeah.
What
Yep.
is your footing in this?
Well, we are working in the operational efficiency side, but obviously there are two big things, right? In a service center, in a service company or business like healthcare, um, if I had to run any kind of a service, I want to increase my revenue and cut cost. But cut cost is very tough. You can only go so far. Revenue is the ultimate thing. How do you jump in? What else can I provide, and how can I take care of my patients? And so that's how you evolve as a hospital or as a health system. So we are connecting in the operations area, but obviously we are going to work with both on the revenue side and on the cost side as well. So example I'll give you. Um, when you have visibility into the system, I'll give you an example of, I'll have to give you an example of, let's say, glucometers. When or some kind of an asset like a glucometer. Glucometers are used very seldomly, very normally in every patient who's coming in who can actually use it. How many do I have to buy? I don't know. I don't care. Give me 100. That's a cost, right? You're purchasing from a vendor and you're using it on the patient.
Right.
But when you're using it, you don't know where to, am I billing them or am I using it properly? Do I know whether this is the right condition? Am I putting it in the right? It's very complex to actually get the right billing. So what normally health systems do is they let it go. The billing is not happening. So with AI, new tools are coming up where you're able to bill properly. It was very frustrating to have an operation in January and get your bill in September of that year because I forgot what happened 6 months, 8 months back. So there are tools coming in so they can do it faster so that they can realize revenue. At the same time, when you know that you only use 50 glucometers, why the hell did you buy 100? That's cost,
Yeah.
right? That area, it's a common sense area. Things are complicated sometimes, complex problems sometimes are simple tools. If you're able to solve that problem of buy 50, use them properly, get them paid for, maintain them properly, then I think your bottom line is also affected because you're getting more and you're spending less, then the extra money can be used back into patient care. That kind of an efficiency, we are positioning ourselves on operational efficiency. How do you properly manage what you have? How do you connect these dots within the nervous system? It's a big mix of nervous system that connects different doctors, nurses, patients, tools, services within the hospital to take care of one patient. How do I make these things efficient and help them on two big muscles of the health system, which is cut the cost and increase the revenue? So when you run your operations right, both of them happen. So that's where we are trying to position ourselves from the middle of the operations.
And if you succeed in your mission, and I know there's no end
Yeah.
finish line, if you succeed, how will healthcare feel for the average person walking in the front door of a hospital?
Well, it makes their life easier. It you can be less assured that there are companies like PyCube who are helping the hospitals. Hospitals are adopting people like us. It's very encouraging for hospitals to have. They are very open in adopting things like these to help the customer at the end. You will have a seamless experience, right? An experience you I what we want to solve. We are animals of our background, right? We only can look at what we went through and what can happen. So, in my view, the experience of a hospital that when you go in and you are not able to take care of your loved ones or yourself, and then you get a bill after 9, 10 months that you don't even remember what happens, but you get a bill from 10 different people
Hmm.
from that's it's not a good experience. If you're able to
No.
solve the problem, a hospital should not be a stressful thing. You're already in stress and bad health shape at that point of time. It should be a seamless experience to a customer, and I hope that is the direction in which all the health systems are going towards. And I think that is going to be as we progress, putting the patient in the middle and improving this experience that they would have going to a hospital. It's okay and it's normal to actually get sick, but it's normal to actually get better and get back to your loved ones also. That is a seamless experience if you're able to give to a patient. That is what we're thriving towards.
Now, just my final question here, just so in my mind I'm clear about PyCube. Are you placing your staff in the hospitals, or are you strictly on a training ground, efficiency, bottom line level?
Well, um, it depends on some hospitals don't want us. Some hospitals, when we are working with some hospitals are very innovative. We go in and we also learn the problems, right? So if I need to solve a problem of a nurse, I need to sit next to them and sometimes see what is really happening because we are a data company. Where is the data flowing? Oh, what happened? Oh, is this the process you're following? So I think our we most of our personnel are used for training and helping them out for the product we have implemented. But there are some health systems that are working with us in a very innovative way.
Mhm.
And there we're actually positioning them for a little longer to learn the problems as well. So we are solutionizing new problems that are coming up. Oh, we could solve this too. That is a big problem we didn't think about. Why didn't we think about it? So it's a partnership that we are coming up with. In one of the health systems that we're working up with, they liked what how our approach is, and then we are taking over their system as well because we can maintain them well and come up with new updates in a different way because health system, you'll be surprised to see hospitals come up with their own tools
Mhm.
because they can't find vendors outside. So but they have no business to be in the IT world or building applications themselves, because maintaining it's very hard and finding personnel is very tough.
Mm-hmm. Fair.
So we take over certain things, keep applying newer concepts and design theories into those applications. It makes the life of a person very easy and health systems very easy. We are looking at those kind of mechanisms as well, where in some operational areas, some tools that were built in, but no one else can buy them. You can't buy them from outside. You can't replace them. But hospital has to have some personnel just assigned for those guys, because that tool has to be maintained. It has to be updated. It has to be constantly look for bugs, security threats, and those kind of things. We're also helping them with those unique problems that they might have. So there we are actually positioning some people in at the hospital and helping them out with those tools. And how do I reduce the number of tools, weird tools that you guys have built over the period of time, bring them down, connect what you have together properly so that you have a seamless experience throughout the health system.
Fair. Now, Sam, if anybody wanted to find out more about PyCube, where would you direct them?
Well, we have a lot of updates on our website, www.pycube.com. We keep posting the interviews, we posting the blog spots, we have data coming in. I also connect with people on LinkedIn. If you have any questions, I'm active there as well. You can find me on LinkedIn, and I'm very active there as well.
Perfect. And as always, these will be included in the show notes. And just a quick thing, PyCube is spelled Pycube. But again, those will all be in the show notes, and lots of ways to access Sam and his company. Sam, thank you very much for being with us today.
Cathy, it's been a pleasure. Thank you.
Everybody, we will talk to you next week on The Health Hub.
You have been listening to The Health Hub, hosted by Cathy Biase, here on Radio Maria Canada.